For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hello everyone, thank you for being here. Today we have an update from the Association of Bay Area Health Officers on recommendations for when the mask mandate for indoors can be lifted. We have Dr. Sara Cody from the County of Santa Clara here to speak, and without further ado, we will turn it over to Dr. Cody. We will take questions afterwards, and we'll call on everyone individually for questions. Thank you.
Good morning, everybody. Good to see everyone and good to be here. I'm Dr. Sara Cody, Health Officer here in Santa Clara County. And today I wanted to talk about masking. Together with my colleagues across the San Francisco Bay Area region, we are adopting shared metrics for when to retire the indoor mask mandate. As you know, in our county, indoor masking has been required since August 2nd for everyone regardless of vaccination status. The metrics that we're adopting across the Bay Area have three parts. First, we need to see that community transmission is low and stable. Second, we need to see that COVID hospitalizations are also low and stable. And finally, we need to see robust vaccination in the population. Essentially, we want to ensure that we have many layers of prevention. We want to make sure that the vaccination layer is really robust before we peel back the masking layer. So I'll explain these metrics a bit more. So whenever possible, our aim was to adopt a metric that would be easy for the public to follow along. And so for the community transmission metric, we're looking at the CDC's metrics on their data tracker that are posted on their website. So we need to see that our county is in yellow for 3 continuous weeks. Right now we're in orange, but we're trending down, and so we may reach yellow soon. For vaccinations, we will be updating our public dashboard to show the percent of total vaccinations, total population vaccinated, because the vaccination metric is we either need to reach 80% of the total population vaccinated or 8 weeks since the 5 to 11-year-old age group is eligible to be vaccinated. So it's an or, whichever one we reach first. The 80% you'll be able to track on our dashboard, and the 8 weeks, of course, everyone will know once the announcement is made that it's 8 weeks after that. And finally, the hospitalization metric, that one is in the judgment of the local health officer. So hospitalizations need to be low and stable in the judgment of the local health officer. That's not one that you're going to be able to track on our public dashboard. And we really spent a long time discussing this metric. It has a lot to do with a hospital capacity in the jurisdiction. I can tell you that in Santa Clara County, our hospital capacity is on the robust side. So that metric is going to be fairly simple for us to meet. Before I take questions, I first want to express my enormous gratitude to the public here in Santa Clara County and across the Bay Area region. We as a region, our public has by and large embraced the COVID prevention measures that we've talked about and asked everyone to do. And because of that, our rates are fairly low. We have had a fourth surge, but it has been relatively blunted compared to the experience in other parts of the state and country. So we have our prevention strategies that we know vaccination, masking, ventilation, distancing, and testing is needed. these are the strategies that protect us. These are the strategies that our public has embraced. And together, I hope that we can get to the other side of this pandemic as quickly as possible. And I'm happy to answer any questions.
We'll call on everyone individually. We will start with the Mercury News.
Looking at the trends, when do you think that we can get rid of the mask mandate indoors? What kind of timeline do you see in this county and perhaps others?
Well, I think it's going to be hard to say. So we have to meet all three metrics. It's an and. Low and stable community transmission and hospitalizations low and stable and robust vaccination by one of these two measures. I would say that we're pretty much there with the hospitalization metric. So what we need to do is watch our community transmission and our vaccination.
So what do you think? Like a rough idea? A week? A month?
Well, I think that the metric that's probably most important and is going to be the most challenging is the vaccination metric, because we need 80% of our whole population needs to be fully vaccinated, or 8 weeks since the 5 to 11s become approved for use by the FDA and the other bodies.
Go to KPIX.
San Francisco is announced on October 15th that they're allowing the mask mandate to be lifted in certain settings, offices, gyms, religious gatherings, college classes. If they can prove that everybody there is vaccinated, there's a long list of rules. Do you anticipate Santa Clara County having something like that that gives private organizations some kind of flexibility in that regard?
As you know, in Santa Clara County, we do not have any vaccination mandates. So unlike some other jurisdictions, we don't have a vaccination requirement or a mandate for restaurants or bars or gyms or what have you. We have always here sought to have rules that are as simple as possible, as easy as possible for the public to understand. And so here in Santa Clara County, as well as most jurisdictions in the Bay Area, we will keep our requirement for indoor masking, regardless of vaccination status, until we meet these metrics that we've adopted across the Bay Area.
NBC.
So in your discussions with your colleagues, is there debate or discussion going on in terms of everybody maybe implementing everything at the same time, so you don't have one neighboring county with different requirements or different standards and restrictions than another county that could be literally a few feet away?
Yeah, thank you for the question. What we decided, and this was a lot of discussion amongst our group, and as you know, the Bay Area health officers, we've been working together quite closely since the beginning of the pandemic. So what we landed on was shared metrics, but it may be that one county reaches the metric before another adjacent county. So we will probably be lifting the indoor masking requirement at different times, simply because the hospitalization and community transmission rates differ by county, as well as the vaccination rates.
So are you concerned, though, that could cause a problem in terms of one county lifting it, the neighboring county doesn't?
I think what's important is that we communicate to you all and to the public how we are thinking about this and what factors are important. And so that there are shared metrics across the region, and that those metrics are something that the public can see. The public can see what % of the population is fully vaccinated. The public can track on their calendar how many weeks has it been since the vaccine was approved for use in 5 to 11-year-olds. The public can look at the CDC website and look at Santa Clara County and see how long has Santa Clara County been in yellow. So the most important thing is that we have metrics that are relatively simple and that the public can see and that we can track them together. We do not have a shared metric across the region regarding reimposing an indoor masking requirement. But what I can say is that some of the things that we will all be looking out for are emergence of a new variant, how the vaccines do over time with any new variant emerging, and things like that.
As you know, a lot there have been inequities in vaccination that is color and local communities. So I'm wondering if the state of Chinese health equity measure was considered in drafting these metrics for mandates.
Yes, there are so many different factors to consider, and so many different factors to weigh together to come up with this metric. All of us across the Bay Area are laser focused on ensuring that everyone who needs a vaccination gets a vaccination, and we've adopted many strategies across the region. I think most counties have the equivalent of our MOVAX, which is specifically tailored to reach vulnerable communities and try to encourage vaccination in those communities.
Mercury News.
Yeah, and just to be clear, if you mean the total population of 80% vaccination, that includes infants, whatever, right?
That's right.
Okay, and where are we now?
Right now, we have, if I've got it right, 72.4% of the total population in Santa Clara County is fully vaccinated.
What percentage of the population is 0 to 11? Because that seems like a number that may not be able to be reached, so you have to go directly to the mandate.
I don't have that number offhand, but what I can tell you is there are just shy of 175,000 5 to 11-year-olds. So that's the size of the population that we anticipate will become newly eligible for vaccination. And that's the population that we're going to be working very hard to ensure that there's easy, accessible vaccinations available to 5 to 11-year-olds when they become available.
KPIs? Do you think we'll have holiday parties with no masks this year?
I think it's important to remember those 5 important prevention strategies to prevent COVID: vaccination, masking, testing, ventilation, and social distancing. We also know that the pattern we've seen by and large with COVID is about a 2 months on, 2 months off, 2 months on, 2 months off. So last year we saw our cases begin to tick up in early November. Whether we'll see that this year, I don't know. But regardless of when holidays are scheduled, what's important is to see how much COVID is circulating and how many of those layers of prevention do I need to make sure are in place to protect myself and my family. That's really the key.
Sounds like a maybe. NBC? Any follow-ups? Anyone else over here? Thank you everyone for attending. We appreciate you being here.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.